Garden by Sullivan.
All right, thanks for joining us this morning. May is Melanoma and Skin Cancer Awareness Month. Did you know skin cancer is one of the most common cancers in the United States? It is also one of the most preventable as well as treatable. Dr. Melanie Kingsley joins me now with more on what you should know. Dr. Kingsley, thank you so much for being here. It's always good to have you on here, and especially an important topic as we start to get into the warmer months and people spend a lot of time outdoors. What are the key signs of melanoma or other types of skin cancers?
So it can come up anyway. So melanoma you think of as a big brown ugly spot on the skin, which it could be, so always look out for that. But it can also come up as a pink scaly area. So just be aware of your body and know, I always say know your moles. So looking over your skin regularly, about once a month. So if anything does pop up, you know to report it, but you're looking for something new, something maybe bleeding, changing colors.
What are the steps? Because we're looking at some pictures here of types of moles, for instance, and they affect people differently. I mean, for instance, can children get them?
Yes. So melanoma is diagnosed in children as well. So just because you're younger doesn't mean you don't have the potential to develop a melanoma. So always anything new concerning, report to your doctor, so your dermatologist, so they can take a look. Let's
talk about those next steps, because obviously people are going to be outside. We've got a big race coming up on Sunday the 25th, the 500, and you see people with the tank tops. They want to be comfortable, they want to be cool, but the sun is blaring. That's a prone time for people who are potentially at risk, could potentially get some type of skin cancer.
That is true. So I know everyone loves the sun. I love the sun. It's good for the mood, good for your vitamin D. But you don't want to burn. So that's the key. There's a statistics that if you get 5 blistering sunburns between the age of 15 and 20, you're at 80% higher risk of developing melanoma. So just be very good about preventing the sunburns, reapplying your sunscreen every 2 hours, and making sure it's SPF 30 or higher.
And finally, how often should people get professional skin exams?
So it depends if you have a history. So if you have a family history, or a personal history, or just a lot of moles or anything atypical, then come around once a year so that we can take a look at you. But those monthly self-skin exams at home are so important, because usually it's a spouse or someone else that's going to be like, wait, that wasn't here last month.
Absolutely.
So do that monthly. Try and see your dermatologist every year for a full skin exam, or at least for a baseline if you've never had one.
Well, I've just been told we got a little bit of extra time, so I'm going to ask you, why is it so important to know about the products and correct ways to care for your skin? And because there's so many different products out there, I'm going to say that a lot more women than men use those types of skin products. How do you know what's right for you?
So you have to listen to your skin. Everyone has different skin types, so more sensitive or more oily. So you have to use one that, you know, is not a lot of chemicals is what I always look for, and is safe for the skin. So many out there.
Water. All right, and this is a question that I have that's not, can you actually get sunburn without the sun?
Yes, so if you're in the shade, you mean?
Yeah,
so,
like on a cloudy day.
A lot of people do. So there are still UV rays coming through the sun. So I even say in the winter, make sure you're wearing at least on your face, because you'll get exposure through the window. But also, if you're at the beach or outside under shade, you can still get sun reflecting from the concrete, from the beach, from the sand, from the snow, from the water. So you're always getting that UV exposure. So just be very good and aware of your skin and be protecting it.
All right, take care of that skin, because it's the only one you have, right?
Yes.
Dr. Melanie Kingsley, thank you for being here. Appreciate it. Dermatologist with information on taking care of your skin. 9:44 right